Ever wondered what secrets older men wish they had known about masturbation? You might think you've heard it all, but these 5 surprising revelations could completely change your perspective. From boosting your health to protecting your heart, these hidden truths can make all the difference. Stay tuned to discover what every man over 60 needs to know about self-care and why ignoring these secrets could cost you more than you think. Hit that subscribe button and turn on notifications because you don't want to miss out on these life-changing lessons. Ready to learn what your doctor might not be telling you? Let's dive in. Advice 1. Protect your heart. Masturbation is often viewed solely as a private or recreational activity, but it may have notable benefits for heart health, particularly in older men. As men age, the risk of cardiovascular issues such as high blood pressure, heart attacks, and strokes increases significantly. While traditional methods like exercise, diet, and medication remain critical, incorporating moderate, regular masturbation into a well-rounded lifestyle can offer surprising support for heart health. When a man reaches orgasm, his heart rate increases, blood vessels expand, and blood circulation improves throughout the body. This brief yet effective cardiovascular stimulation mimics light physical activity, encouraging healthy blood flow. Improved circulation supports arterial flexibility, helps prevent plaque buildup, and may contribute to a reduced risk of heart disease and stroke over time. In addition to the physical effects, masturbation contributes to emotional and hormonal balance. During orgasm, the body releases endorphins, dopamine, and oxytocin, neurochemicals associated with pleasure and relaxation. These hormones play a critical role in lowering stress, which is a major contributor to high blood pressure and heart strain. Chronic stress can silently damage the cardiovascular system, making stress reduction strategies an important part of heart health management. Masturbation also supports hormonal regulation, particularly of testosterone. Maintaining healthy testosterone levels can positively impact metabolism, energy, and even mood, factors that all indirectly support a healthier heart. Additionally, regular ejaculation may reduce the risk of prostate complications, which can influence overall physical well-being and, in some cases, cardiovascular function. However, like any wellness practice, moderation is key. Excessive masturbation can lead to fatigue, temporary muscle strain, or increased anxiety, especially if it interferes with sleep, daily responsibilities, or mental focus. For men with existing heart conditions or high blood pressure, it's wise to consult a healthcare professional before introducing any new physical activity. Even mild ones. It's important to emphasize that masturbation is not a substitute for heart-healthy activities like a balanced diet, regular exercise, medication, if prescribed, and routine medical checkups. Instead, it can be seen as a complementary practice, offering emotional relief, hormonal balance, and light cardiovascular stimulation. When approached mindfully, masturbation can be a simple yet valuable tool in promoting long-term cardiovascular well-being, helping older men maintain vitality and emotional balance throughout their later years. Advice 2. Boost mental clarity. Maintaining mental clarity and cognitive sharpness is a vital goal for elderly men, especially as they age and face natural cognitive decline. Interestingly, one often overlooked activity, masturbation, can play a positive role in supporting mental well-being when practiced mindfully and in moderation. During masturbation, the brain releases several important neurochemicals, including dopamine, serotonin, and endorphins. These substances are responsible for producing feelings of pleasure, relaxation, and emotional satisfaction. Dopamine is linked to the brain's reward system and enhances motivation and focus, while serotonin helps regulate mood and reduce anxiety. Endorphins, often referred to as the body's natural painkillers, not only ease discomfort but also promote a sense of calm and contentment. For elderly men, who may be at increased risk of depression, anxiety, and loneliness, this chemical boost can provide noticeable psychological benefits. By regularly releasing these mood-enhancing hormones, seniors may experience improved emotional balance, reduced feelings of stress, and greater overall satisfaction with life. This, in turn, supports mental resilience and helps combat the emotional challenges often associated with aging. Another key benefit of masturbation is its impact on sleep quality. The relaxation and release following orgasm can help the body unwind and transition into deeper, more restorative sleep. Adequate sleep is essential for memory consolidation, attention, and problem-solving abilities, all of which are crucial for maintaining cognitive health in later years. Poor sleep, on the other hand, is strongly linked to memory loss and cognitive decline. Furthermore, engaging in self-pleasure can foster a sense of self-awareness and bodily autonomy, contributing to higher self-esteem and a better connection with one's physical and emotional needs. This self-care ritual can become part of a healthy lifestyle that prioritizes mental wellness. However, it's important to recognize that, like any behavior, balance is key. Excessive or compulsive masturbation may lead to feelings of guilt, social withdrawal, or even dependency, potentially harming mental health rather than helping it. Therefore, it is essential for elderly men to approach this activity with a healthy mindset, viewing it as a natural and positive way to support their well-being. In conclusion, when practiced in moderation, masturbation can be a simple yet powerful tool to enhance mental clarity, emotional balance, and cognitive longevity in elderly men. Advice 3. Improve prostate health. The prostate is a small, walnut-sized gland located just below the bladder in men. While it may seem minor, its role in overall male health becomes increasingly important with age. Maintaining prostate health is essential for urinary function, sexual performance, and long-term wellness. One often overlooked but effective way to support this vital gland is through regular ejaculation, whether through intercourse or masturbation. Research suggests that frequent ejaculation may reduce the risk of prostate cancer. A landmark study published in the journal European Urology found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. The theory is that ejaculation helps to flush out toxins and waste materials that might otherwise build up in the prostate. This natural cleansing process may prevent cellular damage that can lead to cancerous growths. In addition to cancer prevention, regular prostate stimulation can also reduce the risk of prostatitis, an inflammation of the prostate that can cause painful urination, pelvic discomfort, and sexual dysfunction. By keeping the prostate gland active, ejaculation helps prevent stagnation in the seminal fluid, which can reduce inflammation and discomfort. This is particularly helpful for older men, who are more susceptible to these kinds of conditions. Furthermore, masturbation can support urinary health by helping the prostate remain functional and responsive. A healthy, well-stimulated prostate contributes to proper bladder control and a strong urinary flow. When the prostate becomes inflamed or enlarged, a common issue known as benign prostatic hyperplasia, BPH, it can press on the urethra and disrupt normal urination. Regular ejaculation may help prevent or lessen these effects. However, it's important to remember that while masturbation can be a helpful part of prostate care, it should not be viewed as a standalone solution. Men should remain vigilant for any signs of prostate issues, such as difficulty starting urination, a weak stream, or persistent pelvic pain. In such cases, medical consultation is essential for optimal prostate health. Masturbation should be combined with other healthy habits, a diet rich in antioxidants and omega-3s, regular physical activity, stress management, and routine checkups with a healthcare provider. By taking a proactive and balanced approach, older men can better protect their prostate health and maintain quality of life well into their later years. Advice 4. Enhance sexual function. As men age, it's natural to experience changes in sexual health and performance. Shifts in hormone levels, reduced blood flow, and age-related health conditions can all contribute to challenges like reduced libido, erectile dysfunction, or performance anxiety. However, one simple and often overlooked practice, masturbation, can play a valuable role in maintaining and even enhancing sexual function for older men. Regular masturbation helps promote healthy blood circulation to the genital area. This increased blood flow keeps the tissues of the penis oxygenated and responsive, which is essential for maintaining erectile strength and preventing atrophy. Improved circulation also supports the health of blood vessels, which is critical in avoiding or managing erectile dysfunction, ED. For many older men, masturbation can serve as a natural, non-invasive way to stimulate and preserve sexual responsiveness, Beyond physical benefits, masturbation offers a private, pressure-free environment to explore pleasure, arousal, and personal preferences. This self-exploration fosters sexual confidence, helping men stay connected to their bodies and understand what feels good. In turn, this awareness can lead to more satisfying and communicative experiences during partnered sex. Masturbation also allows men to practice ejaculatory control, helping to build stamina and potentially reduce performance anxiety. Through techniques such as the stop-start method or edging, men can improve their awareness of arousal levels and learn how to delay ejaculation, which can translate to improved performance and endurance in sexual relationships. Additionally, the hormonal effects of orgasm, including the release of dopamine, oxytocin, and endorphins, can elevate mood, reduce stress, and enhance overall emotional well-being. These feel-good hormones help reduce feelings of sexual frustration or inadequacy, which can sometimes accompany age-related changes. However, moderation is essential. Overly frequent or aggressive masturbation can lead to negative side effects such as soreness, skin irritation, or temporary desensitization. For men with conditions like diabetes or high blood pressure, gentle techniques are recommended to avoid putting excessive strain on delicate blood vessels. Incorporating masturbation into a regular self-care routine can offer both physical and emotional benefits, supporting sexual health without depending entirely on medication. Alongside proper nutrition, exercise, and medical care, mindful self-pleasure can be a key component in maintaining a fulfilling and healthy sex life throughout the aging process. Advice 5. Combat loneliness effectively. Loneliness is a widespread issue among elderly men, particularly those who have lost a partner, live alone, or experience limited social interaction. Over time, persistent isolation can lead to emotional distress, depression, and a decline in overall health. While many strategies exist to address this challenge, one often overlooked yet meaningful method of self-care is masturbation, a personal act that can offer emotional comfort, stress relief, and a sense of connection. Masturbation is not just a physical experience, it also has psychological and emotional benefits. During orgasm, the body releases oxytocin, sometimes called the cuddle hormone, which is associated with feelings of closeness, trust, and bonding. For older men who may not regularly experience physical affection, this hormonal response can help fill a void left by reduced human contact. In this way, masturbation can act as a form of self-soothing, helping to reduce emotional pain and foster a sense of warmth and connection. Additionally, the release of endorphins and dopamine during sexual arousal and climax can significantly boost mood and relieve symptoms of depression or sadness. These feel-good chemicals contribute to a temporary sense of euphoria and well-being, helping to combat the emotional weight of loneliness. It is important to recognize that masturbation is a natural and healthy expression of emotional and physical needs, particularly in older adults. When practiced without shame or guilt, it can enhance self-esteem, self-awareness, and provide an important outlet for emotional release. However, masturbation should not become a substitute for genuine human connection. While it can offer relief, it is not a long-term solution for loneliness. Elderly men are encouraged to engage in social activities, join community or hobby groups, volunteer, or reconnect with family and friends. These interactions provide the meaningful connections that are essential to emotional well-being. When masturbation is viewed as a complementary practice, combined with efforts to maintain an active social life, it can play a powerful role in managing feelings of isolation. Rather than being a taboo subject, it should be embraced as one of many healthy coping strategies that support emotional stability and quality of life. Conclusion. Now that you've learned these 5 surprising masturbation secrets, it's time to take action. Protect your heart, boost mental clarity, and maintain prostate health while combating loneliness and enhancing your sexual function. Remember, self-care is more than just a buzzword, it's a powerful tool for healthy aging. If you found these lessons valuable, don't forget to like, comment, and subscribe for more life-changing tips. Hit that notification bell so you never miss an update. Stay informed, stay empowered, and keep thriving.